Hello everybody and welcome to today's edition of Video Clips. And I mentioned this week I was going to focus on various issues, including the comments from very well-credentialed people who happen to share some of my same ideas about this coronavirus episode. Just a couple of things. Remember, you can get a free trial membership, free online workout, a free sample of a yoga class, free newsletter, which includes an article from a couple of days ago where I gave you a lot of data about the coronavirus. Not free, my upcoming mini workshop on vaccines that you do have to pay for. But all that stuff that's free and the vaccine workshop, if you're interested, pampopper@msn.com. All right, so today I want to focus on what's going on around the world, the consequences of the lockdowns and the hysteria. And I'm going to start with giving you some information written by Dr. David Katz. And I'll first of all tell you about his credentials. He's got an awful lot of initials after his name. He's the founding director of Yale University's Yale Griffin Prevention Research Center, past president of the American College of Lifestyle Medicine, founder and president of True Health Initiative, founder and CEO of Diet ID. He earned his BA degree from Dartmouth College, his MD from Albert Einstein College of Medicine, and his MPH from Yale University School of Public Health. Dr. Katz is a board-certified specialist in preventive medicine, public health, the recipient of many awards for his contributions to public health. He has received 3 honorary doctorates. He holds 5 U.S. patents, with others pending. He invented the methods known as evidence mapping and evidence threshold pathway mapping, is the principal inventor of overall nutritional quality index algorithm, invented the first fundamentally new dietary intake assessment method in decades. Dr. Katz has authored roughly 200 peer-reviewed publications, many hundreds of health columns, both online and in print, and 17 books to date, including leading textbooks in both nutrition and preventive medicine. Dr. Katz is recognized globally for his expertise in nutrition, lifestyle medicine, and health promotion. Called the Poet Laureate of Health Promotion by his peers, Katz has given keynote addresses in dozens of countries, on 6 continents, and in all 50 U.S. states. He has a social media reach of about 1 million people. Now here's what Dr. Katz has to say about this. Even though the New York Times put work in the headline of Tom Friedman's column, Channeling My Own, Tom's focus was really not dollars, but the clearly emphasized social determinants of health. Anyone who has ever touched a toe to the waters of public health knows that social determinants, poverty, isolation, education, discrimination, food insecurity, exert a monumental effect on the very outcomes we are most concerned about in the midst of this pandemic. Severe illness, demands on the medical system, and death. The premise then and now is that coronavirus can directly kill via infection and can kill indirectly if haphazard interdiction efforts dismantle societal norms, disrupt supply chains, halt the flow of crucial goods and essential services, and propagate devastation such as hunger, depression, addiction, suicide, and violence. A spike in gun sales and a surge in domestic violence have been documented already, riding the currents born of 10 million unemployment filings. How do we minimize total harms done by this pandemic? How do we save most of us from the worst harms of the virus and the worst harms of interdiction alike? These are serious questions, and they invite serious work to generate serious answers. This was always the proposition, and many efforts required to advance it, our own included, are now well underway. But the United States may already have done too little too late. The valid debate, inevitably disfigured in the meat grinder of pop culture discourse, was like 2 surgeons conferring. Do we need an incision from chest to navel, or do we do this laparoscopically? If both agree that an operation is necessary, the one consideration already off the table is doing nothing. As the coronavirus toll from other countries became clear, the U.S. did nothing. When we took action, it was impulsive rather than thoughtful and methodical. We closed the nation's universities and sent legions of mostly healthy young people to their far-flung family homes from sea to shining sea without testing any of them for coronavirus. So far as I know, no one so much as took the occasional temperature. Such are the liabilities of governance by Twitter feed. And what Dr. Katz and a number of other doctors, as qualified as he is, are recommending is that we have got to have some type of policy to pay more attention to the people who are really at risk for coronavirus, which is the elderly and those in nursing homes and those confined to home care. And we've got to stop trying to keep people like me out of the library. It just doesn't make any sense at all. So now what I want to do is focus on some things that are going on around the world, and I'm just going to start with my own experience. I went grocery shopping a few days ago, and I walked into a grocery store, and a woman was using a Clorox wipe that was about the size of a Kleenex, and she's swiping off the handle of the cart and pronounces it clean and safe. I thought, yeah, I feel so much better protected. So I walk into the store, and you cannot help but pass by people in the aisles. So this issue of social distancing is impossible because the aisles are big enough for a cart going this way and a cart going this way, which means that while grocery shopping, I ended up, and of course everybody's concentrated in a shorter period of time because the stores have limited hours. So I must have passed at least 25 or 30 people right now, I mean, with like this much room between us, okay? So this is really terrific. You can't open a restaurant and people can't sit at tables, but it's okay to go to the grocery store and be 2 inches apart from people all day long. I got my groceries together. I went to the self-checkout section, and I'm standing 2 inches away from the person in front of me, and I finally get a station, and I'm using a piece of equipment that's been used by 200 people before me. I don't really care, but the point is we're supposed to be so careful about everything, so why isn't anybody like hosing it down in between? I'm 1 foot away from the person next to me because that's how the stations are spaced, and I had coupons, and when I pushed the button for the coupons, a guy in a hazmat suit with a gas mask came and processed my coupons. Now, I want to ask you, how is this okay? And I understand it has to be okay. We have to go get food. But tell me why this is okay and nail salons are closed. Tell me why this is okay and we can't eat out at a restaurant. It makes no sense at all. So big stores and big chains get the ability to continue their traffic, and it's not, according to public health authorities, safe the way that they're doing it. And I hate to even mention this because the next thing is we'll all be sent home without food until it's over, and only the very overweight will survive. I'll be gone inside 2 weeks without any food, right? I'm only half kidding because God only knows what these people are cooking up next. So anyway, that was my experience grocery shopping, and it was like I thought I was in a, like from another planet when I'm doing this. This is okay, and it's fine with me. My commentary on this has nothing to do with my perception of my actual risk, which I think is nothing. I'm healthy. I'm not medicated. I don't have any comorbidities. It has to do with why are we shutting everything else down, but allowing that to happen. So only the big stores benefit, and everybody else is being starved out of business. All right, so here is some mail from other people to let you know what's going on. So one doctor writes, I agree that too many people are using the emergency room as a convenient outpatient clinic, and they're pretty much forced to right now because the medical offices are closed. We have people who are members here who report that they definitely need medical care and they can't get it, all right? The problem is not that the hospitals are overwhelmed with corona patients, it's at the ICU level that they're being overwhelmed with inadequate equipment and staff. This doctor says, as a trauma surgeon, I was working in the ER at a large university hospital. We were hit with 2 patients at one time. One had shot the other, and the first had been stabbed by the other person. It was all we could do with our staff and equipment to be able to treat those 2 critical patients at once. The person with the gunshot lived, and the person with the knife wound died. So what this doctor is pointing out is the coronavirus is not overwhelming the system. The system is flawed to begin with. And it is further exacerbated by people storming the emergency rooms and the hospitals to be tested. Everybody with a sniffle or who's been exposed to somebody as a sniffle thinks they're a case now. And under normal circumstances, 4 months ago, they would have said, I think I'm coming down with something. They get over it and go on, but now it gets all this attention. All right, here's an email from a viewer. My wife and I have been doing mission trips all over the world since 1998. We have a real connection with the people of Uganda. We communicate daily with a group of about 12 young people around 35 years old who served us in our clinics there and who we help support financially and spiritually. One young man who has a wife and 3 children sent me this text today when I asked him how his family was doing. Yes, we are well, and we are also on complete lockdown, not even allowed to drive our private vehicles. It's so hard, life now. But we're just praying that this stops soon because we Ugandans here might die of hunger rather than the virus itself, because 90% of Ugandans, we live on daily earnings. I pray your voice, this writer says, and the other voices of reason will have an impact. If this virus doesn't destroy us, the next one will, and certainly the response to it is. Here's something from the UK. I've just finished a telephone conversation with my dentist. I phoned my dentist today to say I have a filling which is now broken, leaving me with pain and temperature sensitivity. He explained we must get it filled in, but there's a small problem. By law, he's not allowed to meet me face to face. This is because the British Dental Association has instructed all dental practices across the country to close for the foreseeable future. He suggested I try to find a pharmacy which sells a do-it-yourself filling kit. I will need to read the instructions and treat my broken molar by myself. The dental practice says even people with full-on infections are sent away and not treated due to risk of transmitting the virus between doctor and patient. When this happens, they prescribe antibiotics electronically to a pharmacy to be collected by the patients. Here's another commentary from a qualified person. Professor Robert Duval from Nottingham Trent University says the collateral damage to society and the economy could include mental health problems and suicides linked to self-isolation, heart problems from lack of activity, the impact on health from increased unemployment and reduced living standards, the point that Dr. Katz was making. Others have also pointed to the health cost from steps such as delaying routine operations and cancer screening. Meanwhile, University of Bristol researchers say the benefit of long-term lockdown and reducing premature deaths could be outweighed by the lost life expectancy from a prolonged economic dip. At the tipping point, they say, a 6.4% decline in the size of the economy, on par with what's happening now and with the 2008 crash, we would see a loss of an average of 3 months of life across the population because of factors from declining living standards to poorer health care. And to that point, at the press briefing yesterday, the question was brought up that the food bank is out of food here in Columbus. And the reason is that there are almost 1 million unemployed restaurant workers, and nobody's got an unemployment check yet. I've checked with people I know who are servers and that sort of thing. All people living on the edge. They haven't gotten a single unemployment check. It is now today, April 4th, and they were let go on March 16th with just a few hours notice. So the demand from on the food bank has been significant. They're out of food, so they need $20 million. And our brilliant health department official, Dr. Amy Acton, who actually smiled when she signed the order to extend the lockdown until April 30th. It was sort of a strange thing to watch. I'd never seen anybody, well, I shouldn't say that, but I'm a little bit worried about public health officials that think that this is something to be joyous about. I think she kind of enjoys the power, but she didn't really have any answer to that. So we have unemployment claims, hundreds of thousands of them being filed just here in Ohio, and there's not enough food to go around and nobody's getting any money. And I really think that the Fed's sending everybody a $1,200 check that they'll get a month and a half from now. That's really going to help. Are you kidding me, right? All right, so here's from another viewer. In Spain, 800,000 people have become jobless and over 1,000 have died, not from coronavirus. Reporters in Spain have sent an open letter of protest to the government called Freedom to Ask, as they want to change this and let government press reporters change the content. On a personal note, I don't know if you remember, my daughter lives in lockdown in Italy. We're in the UK. The impact of the lockdown on her mental health has been worrisome. A panic attack made her faint just as she scrambled out of the bath. She woke up on the floor with a bruised cheek and head, mild concussion. Luckily, she knew someone who is a nurse. Hospital there is not encouraged for normal people, so to speak. We have already seen suicides and shootings as a result in the UK. I'm fuming. Go ahead and be sarcastic. Fully behind you, as are many others. All this sucks, and yet people call me a conspiracy person when I'm just a realistic mom and a psychiatric nurse. So here in Ohio, a couple other things I'll mention to you is that a significant percentage of inner city kids have no internet access. And so this idea of schooling at home is a joke. It's an absolute joke. In the transitional neighborhoods and in the inner city, these kids who were at least occupied a few hours a day when they're in school, they now have all day to themselves. They don't have internet, they can't do their assignments, and they're not allowed to go someplace like the library that has an internet connection. So guess what they're doing? They're starting to deal drugs on the street. And to that point, this was in this morning's newspaper. 6 die of overdoses in one day. The Franklin County Coroner's Office said Friday that 6 people died from suspected drug overdoses in a 24-hour period. And by the way, she says that the coroner says that social distancing measures that are in place as a result of the coronavirus outbreak can cause an increase in substance abuse. You think? And by the way, when we talk about these kids who are dealing drugs and we're having violence and looting, and it's already started here, one of the reasons is that our brilliant public officials have announced that they're letting everybody out of jail. The courts are closed, so there is absolutely no reason to obey the law right now. It's pretty frightening here, and I can only imagine it's even more frightening in other places. Another thing I'll point out to you, this is also from the Columbus newspaper, A Run on Booze. Alcohol sales are up. In fact, from March 15th to March 21st, Ohioans spent $38.7 billion to buy 437,507 gallons of liquor. That's 63% more booze than they bought in the same week in 2019. And so we're drinking more alcohol, we're selling more illegal drugs, we're taking more illegal drugs, we have more violence, we have more overdose deaths, we have kids who are going to be passed on to the next grade, according to what I've read in the newspaper, without any confirmation that they learned anything at all, because that's always a great idea. And I don't know who in the world would think that this is anything like public health, what public health should be all about. So, anyway, that's my coronavirus update for today. Pass this on to anybody who you think would benefit from watching it. My email address is pampopper@msn.com. Thank you for watching.